In this video, we will show you how Genome Enhancer results can be interpreted for further use in clinic on the example of sensitivity prediction towards VEGFA-targeted therapy for 3 colorectal cancer patients. Personalized drug target selection based on the molecular mechanism of the studied pathology is a key to curing many diseases and saving patients' lives. Recent advances in precision medicine have made great progress in predicting the patient's response towards a certain targeted therapy based on the identified genetic variants. However, the truly personalized approach towards prospective treatment selection, which would take into account the full molecular mechanism underlying the studied pathology, generally remains far out of the scope of medical doctors. We in geneXplain have challenged this problem and are proud to introduce you Genome Enhancer, the fully automatized bioinformatics pipeline for patient omics data analysis. Working with all major types of omics data, it reconstructs the molecular mechanism of the studied pathology and reveals the prospective drug targets and treatments that are predicted to be actionable for the given clinical case. Genome Enhancer reconstructs a personalized model of disease-associated gene regulation and builds a network of intracellular reactions responsible for pathology progression in the cells of a given patient. Genome Enhancer works with all pathologies that can be characterized by changes in gene regulation. Proven applications of Genome Enhancer include neurodegenerative diseases, diabetes and metabolic disorders, infectious diseases, hypertension, and cancer. Here is an example of how Genome Enhancer can be used for predicting sensitivity of cancer patients to a selected treatment. These 3 colorectal cancer patients were all treated with VEGFA-targeted therapy according to the clinical guidelines. The treatment response of these patients was to a certain extent surprising, as the patient with worse clinical prognosis had a stable remission, and other 2 patients have died, one with a short remission and the other with no response to the treatment at all. The goal of the study was to show that such response to VEGFA-targeted therapy could have been predicted prior to the treatment start. RNA-seq experiments were performed on tumor and healthy tissue samples of all 3 patients extracted before the start of the treatment. Having run the Genome Enhancer pipeline on the obtained FASTQ files, the molecular mechanisms of cancers of all 3 patients were revealed. The patient with a short remission and assumed death afterwards appeared to have the VEGFA target far not on the top of the list of his tumor regulators. In this patient case, the VEGFA target was on the 71st place in the list of all identified master regulators. This is why the treatment response of this patient was not so strong. Other master regulators were more active in the tumor of this patient, and thus the disease progression was inevitable. Other drugs were predicted by Genome Enhancer as more promising therapies than bevacizumab for this clinical case. The patient who didn't have a visible response to the VEGFA-targeted treatment appeared to not have the VEGFA target in the molecular mechanism of his tumor at all. Other master regulators were controlling the tumor growth in this patient case, and VEGFA-targeted treatment could not provide any therapeutic effect in the given clinical case. Other drugs were predicted by Genome Enhancer as promising therapies for this case. The patient with a stable remission appeared to have the VEGFA target at the top of the list of master regulators of his tumor. Along with some other key drivers of the tumor growth in this clinical case, the VEGFA master regulator appeared to be one of the most promising drug targets in the predictions made by Genome Enhancer. Genome Enhancer has highly rated the VEGFA-targeted therapy for this patient case. Moreover, when switching the treatment from bevacizumab to aflibercept, as suggested by Genome Enhancer, the therapy response of this patient has turned into a stable remission. Other master regulators of this patient's tumor were also identified by Genome Enhancer pipeline. Among them, for instance, there is GSK3-beta, which is a target inhibited by curcumin. This opens additional opportunities of increasing the treatment efficiency for this patient case by simply using this bioadditive. To sum up, Genome Enhancer has correctly predicted the sensitivity to VEGFA-targeted therapy for all 3 patient cases. Moreover, additional treatment recommendations can be provided to the medical doctors based on the molecular mechanisms reconstructed by Genome Enhancer for the studied cancers. That is how Genome Enhancer can predict the sensitivity of a certain clinical case to a selected drug, or can provide a ranked list of all prospective drugs for a given patient case, including approved and off-label drugs, as well as drugs undergoing clinical trials. Within just several hours, Genome Enhancer makes a true research project out of any patient case under study. Get access to the latest advances of clinical bioinformatics in this fully automatized pipeline for patient omics data processing. Activate your free trial account now and enter the new era of precision medicine. If you will have any questions, please contact us via info@geneXplain.com. Thank you for watching.